We've got the Global State of Tobacco Harm Reduction report. We're here in Geneva launching it at the same time that the 2-yearly World Health Organization meeting takes place, where countries get together to talk about tobacco policies for the next few years. So we've got our team here, we're talking to the media here, we have a launch here, really to bring this report to people that we think need to hear about it.
The Global State of Tobacco Harm Reduction report is the first attempt really to map the world of safer nicotine products as it applies to tobacco harm reduction. I mean, there are lots of tobacco harm reduction measures out there. There's smoking bans, and there's health warnings on packets and age restrictions to minors. But even according to kind of WHO figures, those tobacco control measures are just not enough. Smoking rates are rising in a lot of lower middle income countries, and even in the West, where there has been some steep declines in smoking, some of those those graphs are beginning to kind of level out. So there's still many millions of people who, for whatever reason, continue to smoke. Because they smoke for the nicotine, but sadly they die from the tar, they die from all the toxins in the smoke. Some 6 million people a year.
This has really gone my wildest dreams. We must have distributed a couple of hundred copies or more to delegates going into COP here, and you can see people walking along the road reading it. So really I hope we've created a bit of a stir today, but I'm very pleased.
Good morning, people. I'm going to now count to 6. 1, 2, 3, 4, 5, 6. And in that space, someone, somewhere in the world has died from the smoking-related disease.
We have the right to self-determination. We have the right to choose healthier options for ourselves. We're very lucky in that we can do that, because there are plenty of places in the world where they don't have that option. They don't have the access. They don't have the ability to seek tobacco harm reduction, because they will wind up in jail or they will get a fine. And that is wrong. And that is based on the policies that come out of the WHO FCTC, with their mindset of quit or die.
It's a landmark day for us, it's a landmark publication, and I hope it's going to be something that's going to have a tremendous impact. I'd like you just to thank, in the traditional way, the 3 people who presented it this morning.